In Washington, President Trump is looking to slash federal research funding next year with cuts to the National Institutes of Health. A nonprofit research company estimates this move could cause a loss of 300,000 jobs at healthcare organizations across the country. Our Ryder Blair explains how this could also impact Mayo Clinic.
The Trump administration is proposing major funding cuts to the National Institutes of Health, from $48 billion this year down to roughly $28 billion next year. That's a 43% drop. And according to the nonpartisan research company Brookings Institution, it's not just science that would take a hit, it's jobs, including right here at Mayo Clinic. The White House argues it's cracking down on grant misuse, claiming, quote, an unsafe lab in Wuhan, China, the most likely source of the COVID-19 pandemic, engaged in gain-of-function research funded by the National Institutes of Health, end quote. But Brookings Institution finds NIH grants do far more than fund science. They boost local economies. It says when NIH funding goes up, so do jobs, degrees, and research activity. And when it drops, communities feel the change. Between 2019 and 2023, Rochester topped the nation in NIH funding per capita with more than $1,200 per person, largely driven by Mayo Clinic. If the cuts pass, Rochester is estimated to lose around 2,700 jobs. Putting that in perspective, Southeast Minnesota added about 3,000 jobs between 2023 and 2024. Among bigger cities like Boston, with NIH funding per capita at more than $600 per person, Brookings Institution suggests the potential cuts would lead to a loss of 29,000 jobs. As Congress looks to vote on final 2026 funding levels by the end of this fiscal year on September 30th, some senators are pushing back, even proposing to increase NIH funding by $400 million. Reporting in the studio, I'm Ryder Blair.